Well, we're going to start our webinar now. Thank you everybody for joining. This is a special opportunity for us to talk about our experience, particularly in a country, Senegal, and understanding COVID-19. Good morning, good afternoon, and good evening. I know there are people all over the world, and we'd like to thank you, first of all, for joining for our Second Life Forum on a series called Understanding COVID-19. And today is a conversation about real-time epidemic response, and we have an excellent speakers lined up with Aminatu, who I'll introduce in a moment. My name is Linda Vencel, and I'm the Director for Global Health Security at PATH. And I'll be talking today about the situation globally, but also specifically we'd like to emphasize Senegal. And I feel very lucky to be guiding this conversation. I really started my global health career as a Peace Corps volunteer in Senegal. It's very dear to my heart, and it's also an example of a country that I think has done a lot of work in preparation. So we're very excited to be talking about that. But before I get started, I just wanted to run through a bit of the logistics. We want to hear from you during this conversation, so please share your questions and comments with us by submitting them in the chat box. And then we will be looking at them throughout the presentation, and I'll be monitoring the chat box, and we'll be saving the majority of this hour for questions. We really want to be able to answer your questions, and I'd also like to invite you to join the conversation online by tagging us at PATH Tweets. This call is being recorded and will be distributed for those who are unable to attend. And I want to thank everyone for joining us today and for all you're doing in our communities, for your incredible support right now. This call is not a fundraising event, but we are absolutely fundraising right now, and work has never been more urgent or important, and financial flexibility to respond is needed during this really important pandemic. The format for today's discussion will be fully questions and answers, so we'll plan to have our videos up as opposed to slides for most of the webinar. However, if internet connectivity becomes a problem, we'll adapt. So I'd like to talk a little bit about PATH. For those of you who are less familiar with PATH, we're a global organization and a global team dedicated to achieving health equity so that all people and communities can thrive. And this pandemic has really brought that alive about the importance of equity. And together we're driving public health solutions that meet the most pressing needs of families, communities, and countries throughout the world. And our specialties at PATH range from vaccine research and development, diagnostics, drugs, devices, and health systems, which is a very important part right now, is having a vibrant health system. And we're a global team working in 70 countries around the world. And today's discussion will drive into real-time public health efforts underway to support Senegal's response teams as they fight the pandemic. And we're joined today by Aminatu Sarr, who is our Senegal country director at PATH. And hopefully we will have Dr. Abdoulaye Buso, who is the director of the Health Emergency Operations Center in Senegal. Ami has been leading the Senegal country program for PATH since 2016. She's a former journalist herself, so we're very lucky, and she has led Amnesty International's West Africa office. So I know there'll be a lot of questions, so let's jump in. Aminatu, I have a question for you. I wondered if you could start us off. To date, the worst outbreak has been in the US and Europe with COVID-19, where they continue to struggle to contain the virus. And outbreaks in these countries have exposed weaknesses in health systems in wealthier countries. As PATH, we're concerned about what will happen when the outbreak hits countries with less infrastructure and health systems with less capacity. And it's incredibly concerning, but on the other hand, we look at Africa. There's extensive public expertise across the continent. Several communities like West Africa and DRC have recent experience banding together to control the outbreak, so it's impossible to know. But what is your perspective on how the coronavirus is impacting sub-Saharan Africa at this time?
Thank you, Linda, and good afternoon, everyone. Good morning for those who are following us. I think that, yes, we don't know how it will be, but what is sure, seeing what is happening in Europe, seeing what is happening in the US, we can't afford in Africa to have this type of epidemic, this magnitude of the COVID-19, because of the weakness of our health system. It is concerning. We are worried because we are seeing more and more cases in Africa. It started with 1 case, 2 cases. Now we are having around 10 cases per day in a country like mine in Senegal. And what is more concerning, it is all these community cases, what we are calling these cases where we don't know how and when the person has been infected, which is a big concern in countries in West Africa. And I think that it can be escalated to most of our African countries who are now reporting all cases of COVID-19. It's very difficult to flatten the curve in countries where the majority of our population is getting their living from outside, from being in the streets. They are in the informal business sectors. They need to be outside to get to their food. It's very difficult in these conditions to get people to understand social distancing. I don't like really this word because we are in countries where we like socializing and being in touch. I think we need to talk about security or health distancing, something to explain to our communities, to our people that we can't afford to have an outbreak of COVID-19 in our countries. If the countries in Europe, in the US and other rich countries are struggling to tackle the pandemic, it will be even worse if we reach the same situation than in the US or France or Spain or Italy. We can't afford such a pandemic in our country. That's why we are very much happy and supportive to some of the decisions taken quite quickly by many of our governments in terms of restricting movement in the country, state of emergency, curfew in some of our countries. We know that a complete lockdown will be dramatical for many people. So we haven't reached yet that situation. But if we continue to have this trend, to have these cases increasing day after day, I fear that we will end up with a complete lockdown. And in this case, yes, we don't know what will happen.
Aminatu, can you tell us a little bit about when the cases first started in Senegal and about what were some of the first medium or communication to the population at that point? Because I know that is a time where people are getting the first information that Senegal is actually one of the first countries in Africa to be hit by the pandemic.
Yeah, absolutely. I think that right after Egypt, we were one of the first countries. I think 3rd of March, we had our first case. And now we have almost 300 cases. And every day we have new cases. And it's a concern because we see the cases growing and growing and growing, and we see what it means in Italy and what it means in France and in Spain. And I think the Senegalese government took it very seriously right from the beginning. The first decisions has been to close the airport because our first cases are from people who came from Italy, from France, or even Spain. We have lots of our nationals, lots of Senegalese living abroad who were very happy to come back to Senegal, which is maybe once in a while they are coming for this religious celebration. And some of them came with the COVID-19, and this is how it started. So we had to close our borders. We had to put a state of emergency where there are restrictions in movements between regions because we are seeing this community contamination increasing. And there is a curfew from 8 p.m. to 6 a.m. every day. I think this is one of the reasons why we don't have this explosion of cases that we are seeing in other countries. We were lucky to see that the government is taking things seriously, but it goes also on giving advices on how to protect ourselves using masks where possible, restricting gathering, restricting religious gathering and social gathering. It has been very hard for us, like as Senegalese. We are doing lots of religious gathering. We really are always very supportive to each other when there is a grief. So baptism or funerals, it's very difficult to explain that we need to restrict this type of gathering. At the beginning, it's been hard, and the police even had to go to some of these gatherings and have been very harsh. The first day of the curfew has been very harsh on people because people were outside. But I think that more and more people understand these advices. We understand that if we don't do these efforts now, which is hard, we know it's hard, it will be even worse, because we've seen the example elsewhere, and there is no reason why we should be escaping to the trends elsewhere if we don't do this. And we've been in these countries where we have started putting in place these restrictions, and so far it is not exploding as somewhere else. We are only having 2 deaths so far, which is always too much for every of us. And we are having more and more cases and community cases. And the government continue advocating, communicating, using local languages, doing small animations, small videos, the radios. We are even receiving short messages, text messages on mobile phones. There is a lot that is being done in continuing to sensitize the general public, to sensitize Senegalese that they need to stay home. And it has been done through the channels, through the artists, through the religious leaders, through all the opinion leaders that we have. The mosques are closed, the church are closed. In this time of Easter, I bet that it was very hard for our Christian compatriots not to be able to celebrate Easter properly. We've seen some of the people who have funerals just being allowed to have 20 people to go to the cemeteries. This is extremely painful, but this is what we need to do to flatten the curve in our country.
Well, I mean, Natsu, what you're saying is really correct. I keep in touch with a village that's near the Gambian border called Gayan Chebo, and I communicate with them through WhatsApp and through video, and they were telling me that they're following exactly what you said, and it's a mixed population of, you know, Muslim, Christian, and everything. And what's it's a really difficult time, but what I've really seen is a solidarity, and it's amazing that the healthcare workers are also so cherished, and the populations want to make sure that they're safe and protected, which is so important at this time. Tell me a little bit more what it's like being the leader of an NGO right now, working in Senegal. What are some of the questions or some of the things that are at the top of mind for you as a priority, not only for the people that are working at PATH in Senegal, but also as a leader in the community? What are some of the things that you're hearing from other NGOs as well?
When you are working in an organization like PATH, I think that you have even more responsibility to be there, to set on the side of the Ministry of Health. They are our daily partners on many health issues. And this is a very difficult time for our health system, but it is also a difficult time for NGOs like ours working in the health field. And I am lucky, and I'm proud to say that we responded positively. We said solidarity. We showed solidarity with our health partners. PATH has been supporting the Ministry of Health to put a tracker, COVID-19 tracker, to help manage the cases. We are working to see how our other health areas can be used to redirect some of our resources in the COVID-19 response, because this is the emergency for our health system. If we are not there now, we won't be relevant in the future. And this is why we've been very active in supporting in whichever way we could. And we were lucky also to see some of our donors to understand the situation in which we are, and allowing us to redirect some of our efforts in responding to the COVID-19 in the country. It's not only PASS doing this. There are lots of other organizations bringing their expertise, bringing their resources. And what is also some kind of frustrating for some of the organization is the restriction. PASS is part of this the association of international NGOs operating in Senegal. It includes health organization, but also education organization, human rights organizations, lots of organizations who are working daily with different part of the government here who would like to help. Because of the restrictions between the movement between the regions. For example, we've seen some of the members of the UNGIS, which is the international NGOs operating in Senegal, being very sorry to have not been allowed to bring their support in the areas where they are operating, because the response is not only health response, the response is also how we make sure that all the system doesn't collapse. Because this COVID-19 has an impact not only on health, but it has an impact on other areas of work where lots of organizations are trying to strengthen our education system, to strengthen our other health areas besides the infectious diseases, our malaria work, what does it speak for our vaccine work, and many other health areas where we need to continue to support people to take care of their health. It's a very difficult time, but at the same time, there is lots of solidarity. People are bringing money where they can. People are bringing expertise. People are bringing knowledge using the IT. There are lots of applications, so lots of innovations. People are very much conscious that we are all in the same boat.
Yeah, I understand. And tell me, there's a lot of other bordering countries with Senegal. Have you been aware of how are we communicating with some of the other countries? For example, the Gambia is right in the middle of Senegal and other countries. How are countries working together, or what have you seen as far as how is that working or not from your perception?
From my perspective, I think that we need to be together. Senegal can't work without Mauritania. We have some of our cases. The first case in Mauritania was someone who has lived in Senegal for 21 days in southeast. Our first case in southeast of Senegal was someone who has been tested positive in Mauritania. So it is very important that we exchange information between countries. We have borders where people are going in and out. These are administrative borders, but for people living in the Gambia, living in Mali, living in Guinea, living in Mauritania, these borders don't exist. That's why we need to put together not only the data we have, but also the intel we have to support each other. What I have seen, like for our work in Tambacounda, for example, which is in southeast of Senegal, we've seen that there are people crossing the border to come to Senegal, and the governor has already put in place a task force to see how we can manage the cases of people who will cross the border by putting together by putting groups at entry points where the people are checked. And those who are suspicious cases are put in quarantine, and the families of contact are also alerted and put in quarantine. And this is the type of thing that we need to do. We are in the situation where actually this virus is showing that we are all connected. Who could suspect that this virus coming from China will end up in our remote communities and areas? And this is why we need to work together. Those who have the knowledge need to work with those who have the means, need to work those who need this knowledge and this means to fight this disease. Of course, there are lots of controversy, lots of comments about this is not more deadly than malaria or many other diseases that we are having, but we are in this unique situation where in 24 hours, you can see this toll of deaths across the world. This is unique. This virus has totally jeopardized our daily lives, and we need to be conscious that this is why we can't do it alone. We can't do it by our own, and we need each other to overcome this difficult situation. And yes, there is solidarity between the countries that it existed before, because we are in the same space of the West Africa region, for example. There is already lots of collaboration, and it is even more important now that we are facing the same COVID-19 crisis.
Yeah, and I'd just like to add, with the Emergency Operating Center in Senegal, you know, it's been active and very vibrant now for many years. It was activated when there was polio cases that were, you know, introduced into Senegal. And I'm looking at emergency operating centers and how they're becoming active all over Africa and around the world. And one of the things that I think is really interesting is that they're not just the national emergency operating centers, but how do we get out also data connectivity to some of the more remote areas using mobile emergency operating centers, and also to improve the connectivity using a lot of our digital health tools, which I think are very important and is a really important area of path. For example, I know that we're working with UNICEF, we're working with MSF and Resolve to Save Lives on how to be able to make sure that we have applications like mHero, which I know is a way to check up every day by mobile phone with healthcare workers to make sure that they're safe if they have the right personal protective equipment and all of those resources. And I'm sure in Senegal that's being used by Dr. Buso and by the Emergency Operating Center there.
Of course.
Do you have any questions for me, Aminatu?
Yeah, I think that at the beginning, at the start of the pandemic, there was only 2 countries who were able to test for this COVID. Now they are 47 African countries who can do that. So very quickly, we've been able to catch up. And I think, Linda, you are best placed to give us a global perspective on that. As our global leader, as someone who is leading our global health security work at PASS, you have a unique perspective on how ministries and Department of Health around the world are responding to COVID-19. Places that have started to flatten the curve and control the outbreak must be successful for a few reasons. So what is your perspective on what has worked and what hasn't globally?
Thank you for the question. You know, it's challenging because the most important thing is a preparation. And what I've seen has been really important. And one of the successes is those that have laid the groundwork early for global health security. And, you know, global health security is now, it's in its 5th year, you know, following the really devastating Ebola outbreak in West Africa. And I think that when we started to work with, you know, funds from the US government and from others, one of the key things was setting up a really robust surveillance system. And that includes, you know, including the animal sector, also including community health workers. And one of the key things is including the community-based surveillance and event-based surveillance, where you're actually getting messages from the community about any unusual event. The earlier that we can have a detection so that we can do a proper investigation and find out whether it could be a suspect case of COVID-19, I think is critical. So those are one of the things that I would mention. Another one is very interesting is from my colleagues in India. In some of the areas, especially in the southern part of India, I think one of the things that has been very successful, and we're also talking about that in the United States, is about how to involve different people in the community, because it can't just be the healthcare workers to do contact tracing and to really get ahead of the curve in that sense. If we can do that and be able to do the proper contact tracing very thoroughly, that has been shown to be a success in several countries. And then another example that I would give is in DRC, they're really working with the digital health community and with, setting up and applying a lot of the new applications that we have for contact tracing, for making sure that we have logistics planning in place, and that we're actually using satellite imagery and mapping to be able to identify areas and to be able to make sure that we're applying the right kind of active surveillance. So those are a few of the things that I've seen that have really worked in some of the countries so far.
And you know that, Linda, we are in the peak of the pandemic, so there is a lot of focus on flattening the curve. But another important part of this conversation is, what do we do post the pandemic? How do we work together on what we anticipate would be the next challenges once this pandemic is over? What happens when borders are open? What's the social impact? What's the psychological impact of this? I think these are the things that we maybe need to start thinking of. I don't know, what is your perspective on that?
Well, I think one of the most important things, first of all, very much from the beginning of this pandemic, is it's not to point fingers or identify that it's a certain country or a certain ethnic group or a person that is uniquely going to spread the virus. It's all of us. We can't predict who might be exposed or who might spread the virus. So I think it's important that we look at this from a holistic sense, from a humanitarian sense, that we're all in this together, and there is no way of identifying certain people that are spreading the virus. So to be really in a place of equity about this, and to be able to try to make sure that the tools that we have are applied to those that are the most marginalized populations, I think is very important. Another thing is a health system strengthening. I think that we need now more than ever to join with the private sector. And there's been a lot of private sector engagement to want to help, from tech companies to also larger multi-sectorial groups that are working. And so this is a time when we can not only rely on just, say, the United Nations or one government's resources. The effects of this pandemic are going to go far beyond just the infectious disease part, but also the economic repercussions that are going to need a very important space of recovery. So I think that those are the next steps. How do we look at the immunization systems and other really important health programs that have been affected by this pandemic, and how do we recuperate quickly? So I think those are some of the key elements that we're going to be looking at.
Yeah, thank you, Linda. I think that there will be a new normal, if we can talk about a normal. What is sure is this pandemic has a huge impact on our health system. For example, we've seen that most countries are postponing their immunization campaigns for measles, polio, meningitis. Even ourselves in past, we have opposed many of our activities on the field. All the efforts are being concentrated on the COVID-19, but we need at the same time to make sure that all our system doesn't collapse after this, because there are the other people who are suffering from other diseases that we need to pay attention to. I am very much sensitive of all the advices that are given to people is, if you feel you have fever, if you don't feel well, stay home and call the emergency number. But is it an advice? If you don't have COVID and you rather have malaria, you better have the testing on malaria. What does it say if you have other chronic diseases? And it is why I am always worried about the magnitude of the impact of such a pandemic on our health system, who already is very much weak.
Thank you, Ami. I see that I think we have Dr. Buso, who is the director for the Emergency Operating Center in Senegal. Dr. Buso, can you join? Can you hear us?
Yeah, I hear you. Sorry, I was in the meeting.
No problem. So Dr. Buso is a director for the Emergency Operating Center in Senegal. Thank you very much for joining. We know that you must be very busy right now with your team. Maybe you can tell us a little bit more about the latest epidemiology and what it's been like for you as the manager of the Emergency Operating Center at the national level dealing with this whole pandemic.
Yes. Now, as you know, we are activated as the EOC to manage this outbreak in Senegal, and I'm also the incident manager for this situation, and we have our IMS structure. Now, the situation in Senegal, we had our first case in 2 of March, and today we have 299 cases now. To this, and okay, I just want to give you the number of recovered people. I have it in my note. And normally 85 person who recovered from our health center, what is a little bit good. And we have most of our cases are moderate now, but at this time our challenge is we face some community cases. We have a number of community cases every day, and we try to investigate those cases to see what is the situation. But for all those cases, we try to have all the contact. And the strategy in the country is to confine all the contact in hotel, and it's what we did. And also all the patients tested positive are in our treatment center.
Dr. Buso, we'd love to be able to see you. Do you have your camera covered?
Okay, yeah, I covered my, sorry. Again.
Ah, there you are. That's much better. Now we can see you. Thank you very much.
Please, I have a call from my minister. I want to take it, please. Sorry.
See, this is real life during emergency. So this is a good flavor for what it's like to be the director of the Emergency Operating Center. Maybe we'll pause for a moment and see if there's a few questions. Let's see.
Hello. Yeah, sorry.
Please go ahead, Dr. Buso.
Ask some question regarding the situation.
So one of the things that Dr. Buso that people have been asking about is Senegal is a very social country. It's a country where I imagine that doing quarantine or social distancing, as you mentioned, in a hotel must be extremely difficult, especially in rural areas or in areas where that may not be possible. Can you tell us a little bit more about how that's happening culturally and what may be some of the things that you've had to do to be able to implement that and still, you know, maintain the community's engagement and not have any alienation in this really difficult time?
For the confinement, what the government decide is to take all the hotel in each region. For example, we have some cases in Goudiri in the southeast of Senegal, and there are some little hotel there, and all the hotels are currently requisitioned by the government, and all the contacts are inside. It's not a problem now because people accept that. And in Dakar is the same, and all the region where we have positive cases, all contacts are identified and put in hotel. And at this time is not difficult. Also, in some cases at the beginning, we put in quarantine houses. We have a case in the house. We did it in Touba. All the family was in quarantine. And what the government did is to support this family by bringing food, waters, and everything to support them, and also to assist them with medical staff until they are out of the incubation period. But I think at this time, yes, it's okay. People accept that. And we have some situation where we take time to put people in hotel. the neighborhood call us and to say, oh, in this house, people are still there. We need to keep them and bring them in the hotel. Yeah, at this time I think people agree on this strategy and follow all the rules.
Thank you. I see another question is, how are US-based NGOs and philanthropists supporting Senegal, offering technical or other assistance?
Yes, we have NGO here, we have WHO, CDC, Shy Clinton Initiative, we have UNICEF. They are part of our response, and they are integrated in our IMS structure. And yes, we have technical support from them, but every time I ask them, we need some equipment because we need some protective equipment, and at this time it's difficult to get it from outside. And but we have this technical support from those NGO. Yeah.
Well, I know I still remember my Wolof from being in the Peace Corps, and there's a saying that's "Nit nit ay garabam," which means people are each other's medicine. And I know that one of the questions, and we talked about this with the Emergency Operating Center, are some of the needs. Maybe you could tell us, I think this is very interesting, this is where some of the money is being channeled from philanthropists and some of the flexible money that we need. Can you tell us a little bit about the Senegal Virtual University and about how that could be a very important thing since we can't get together for trainings? This is a different way that we can actually develop short videos and training for people in other regions. So maybe Dr. Buso, you can talk a little bit about that and how we're using it.
Yes, you know, with this outbreak, we received many kind of support or intention to support us. And one of them is the virtual university, Senegal Virtual University. And we discussed with them because we had one issue regarding the training now that we say all the people need to be separate. And they propose us to record all the training. And we start to do that, to record how to explain the SOPs, to record some lesson. And they made a platform where all those video are, and in each region they can reach this platform and yes, follow all the lessons that we record here in the PHEOC. And I think it's something very interesting. And I'm sure that after this outbreak, we are going to move on and to try to develop this kind of strategy.
Dr. Buso, I have another question for you. You and your colleagues in Senegal are really seen globally as one of the best in responding to epidemics. And Senegal's story about the 2014 Ebola outbreak is fairly well known and incredible. While Guinea and a lot of neighboring countries in West Africa saw thousands and thousands of deaths, Senegal had just one case, and that person survived. Can you share a bit about our listeners about Senegal's legacy in epidemic preparedness, and what were some of those lessons that you learned from the Ebola outbreak that apply here? Because I think, again, Senegal people are looking at it as one of the leaders that we can learn from in Africa. So we'd love to get your sense of some of the things that you're applying from the Ebola outbreak for this current pandemic.
Yes, I think we learn a lot from Ebola outbreak. I think the first thing is to have a strong health system. Our health system is not very strong, but we have, I think, a baseline with motivated and trained people able to run things. And also the health system structure is, I think, function well. And we try every time to let the local level to do their job and not to come from the national level and to the job of the from the local to the local level. For the Ebola, the first thing I think is the PHEOC. It's just after the Ebola crisis that the PHEOC was set up. And I think now we can see the added value of this PHEOC to have one structure where you have all people working and people are already trained, prepared to manage this kind of situation, knowing all the concept of public health emergency management. And it gives to the country the leadership of the response. And for me, it's very important for the country to have the leadership of the response, even if we have many international experts coming. but the country needs to have the leadership of this response. And for me, it's important we have team well-trained that can do this job. And also for the communication, I think we learn a lot from the communication and taking account of what the socio-anthropologists advise. Because for the Ebola, I remember the only target we have is to cure the patient, to keep all the contact in one place, and after, yes, if we have no case, we are happy. But after we know that we work with human, we work with people, we need to take account of many other things regarding people. When we put people in quarantine, there are some aspects that we need to take account. And now we develop our psychological support, socio-psychological support, and we have a team on that, supporting the responder, supporting the contact, supporting the patient in the treatment center, and it's something very, very important. Yes, and it's some lesson learned from the Ebola outbreak. And also one is the leadership, is the engagement of our authorities at the higher level. The head of state is really engaged in this COVID, and I remember that when we had our first cases of COVID, we were in the meeting with the President of the Republic, the 2nd of March. And it was a meeting where he convened all the technical people and the government to discuss on the situation and what kind of support the Minister of Health needs. And the same day we had our first COVID, and he convened also another meeting 3 weeks ago. And yeah, it's very important to have an engagement at the higher level with the head of state.
And I also would say from my experience, another thing is to include religious and traditional leaders as part of the whole social support during this pandemic, and then afterwards as far as the recovery. How can we all work together, I think, is also very important. And that was a big lesson learned for the surveillance and reporting with polio, but now also for this epidemic. Aminatu, I would like to see if you have anything else to add to this topic.
What I wanted to say is we have seen a very resilient system here in Senegal. We couldn't suspect that we will be able to keep the cases at this space. I think very quickly Senegal has understood that we can't afford to have a spread of this. The right steps has been taken, and as Dr. Buso was saying, it came from the top level. The president did videos on hand washing that has been shared. All our local languages has been used, and as we go, he is taking new decisions, communicating it to the population on TV, on the radio. So we felt that someone is in charge. People are taking care of us and our health. And there has been lots of call for solidarity that people understood. It's not very easy to lock down a city like Dakar. We are more than 3 million people. But there are already some steps that has been taken, which I know have tremendously contributed in not speeding the spread of the disease. And I'm sure that if need be, then the government will be ready to also take more steps or extra measures to tamp the situation. So I'm very much confident of the resilience of our health system and capacity to try to fight this COVID-19.
So I have two other interesting questions for you, or maybe I can answer some of it too. One is, how do we deal with misinformation and rumors? People are getting onto the internet. There's lots of different information about how the disease is spread, things that actually cause, I think, more paranoia than help. maybe one of you can comment on how we're trying to make sure that the right information is getting to people. I mean, I could give, for example, in Vietnam and in DRC, one of the important things is to push out information through help with our private sector, with mobile phone companies, to make sure that every day adequate messages are being pushed out, and also given a 911 and a 1-800 number so that people can call and get correct information. What about in Senegal? Can you tell me about what are some of the things that you're doing to make sure that accurate scientific information is getting out, but also people are able to ask questions that they might have?
For Senegal, I think the first thing is to give the information every day. The strategy is each morning at 10 a.m. the Minister of Health make a declaration on the epidemic, the number of new cases and everything. And during those, sometimes we have the opportunity to make clarification on some specific question. And also in our team, we have a group who is in charge on the social media. And we already work with some digital manager. The Minister of Health has his Twitter page, Facebook, all those things, and use it to bring information. And sometimes if it is need, they can take short video. Sometimes they come to me to say, okay, can you talk about quarantine? Can we talk about this things of vaccine? Can you talk about rapid tests? And they go to see some experts to give their point of view on just for 2 minutes clarification for the community. And also we work with the civil society. Thank you, civil society. And we receive them. They really want to support this response, and they said they need to have the real information, and they help us also to spread the good information by their network.
Thank you. Aminatu, I have a question for you. It seems like Senegal has this pandemic quite under control, but where we see the biggest number of new cases, quite frankly, is in US and Europe. What advice would you give right now for US or Europe as far as some of the things maybe that we could learn from the experience in Senegal with this pandemic, but in general from the health system and what we're doing as an NGO as PATH?
I think there is a general advice on stay home. I think the stay home is a good advice. The social distancing, it is. This is just a matter of a time, which is a very short time in our life, that we need to trust our health system, to trust our scientists, to trust our leaders, that the advice that are given is very important to be followed too. And I may not have an advice for other countries. I think it works for everyone. Even in Senegal, some people are still wandering in streets, going to the markets. There are crowds on some other places, but I think the general comment is stay home, put a mask, be mindful of others. If you don't protect yourself, think of the others and protect the others. And this is the type of message that are going here. And this is the type of message I would have to all the people who are facing this disease in their country.
And I would think another thing is that the information and the technology is moving very quickly. This is a new disease, a new pandemic, and I know that PATH is very involved on looking at different diagnostic tools, rapid tests, also working on getting a vaccine candidate moving quickly. Those things take time, and I think that one of the important messages also that we can give is that we're doing things as quickly as possible, but we want to make sure that the best tools and the best, science as possible is being applied during this. And that's one of the things I think that PATH joining with the government of Senegal is working well. We're learning a lot from other countries. I'm seeing that across the globe, people are sharing information and trying to problem solve like I've never seen before, which is really fantastic. So one of the other questions is, what resources do the response teams in Senegals have already, and what is critically in need of? And what should the global community best support for efforts at this stage? Dr. Buso and Aminata, we talked about this. I know that a lot of it is making sure that other important programs like malaria and others are kept going so we don't fall backwards. Also other things like polio eradication. But I was wondering, Dr. Buso and Aminata, if you could say, what are the things that you still are in critically need of that would be helpful right now if you were to have more resources at this very moment?
I missed the first part of your question. Sorry, I was on phone.
No, no problem. I was saying, what are some of the resources?
If you had $1 million, how would you use it, Dr.?
Your mic is not very good, Aminata.
Okay, I can repeat it. If you were to have more resources, $1 million, say, what are the response team needs in Senegal right now, or what are you critically in need of that would really help to make you feel more assured that Senegal had everything it needed to be prepared and to be able to stop this outbreak, inshallah?
Okay, for the, I think then, it's a big question. The need, yes, I think is to reinforce the capacity of the team on the field. I think one of the big part is for the IPC.
Infection prevention and control.
Infection and prevention control, to strengthen the capacity in each region of Senegal. Because what we saw now, we have just a small team of maximum 5 people who do all the turn of Senegal, and it's very difficult. And we want to set up treatment center in each region. And yes, we see that we have a lack of human resources specialized in IPC. Also, I think we need to reinforce also the capacity of the rapid response team in each district. Some capacity on investigation, epidemiology, and other, and also bring them some equipment, because now what we try is to dematerialize, on dit ça?
Yeah, dematerialize, yes.
Dematerialize all the document we have to have in real time all information, and it's our big challenge now to have information in real time, because we have now many contacts to follow, more than 3,000, and yes, it's very important to have these things.
Well,
and also,
I know. Go ahead.
C'est bon?
Oh, oui, c'est très bon. Merci beaucoup. I wanted to thank everybody. I know that we're at the end of this time for the webinar, but I wanted to, this is real life. Dr. Buso, as you can see, is busy taking calls from the minister. We're all working hard. I wanted to thank our 2 panelists, Aminata Sarr and Dr. Abdoulaye Buso, for joining this. You see what it's like really in real life dealing with this. And I just wanted to say thank you to everybody in the audience. I know this is a difficult time for everybody personally, trying to keep going and motivated as we can to keep our work going, and wanted to thank everybody for joining this webinar. And we'll be continuing with more webinars as we move forward. So for those who attended, thank you for your engagement and thoughtful questions. Unfortunately, we weren't able to get to all of the questions, but we hope you'll continue to follow our series of webinars to hear more from experts within and outside of PATH. So whether PATH is new to you or you have followed our work for a long time, we appreciate your involvement. Stay in touch and learn how you can support the COVID-19 response. And thanks again to everybody. And I'm wishing you all good health and a good rest of the week.
Thank you. Bye.
Thank you.
Merci.
Jërëjëf.